Hello and welcome everyone to the PI webinar on wellness and care practices beyond 2024. We're going to kick this off with a video to set the stage, and then we'll go into our introductions.
Can you see the video, Maureen, or no?
I can't.
Okay. I'm just going to share my entire screen. Can you see the screen?
I don't see it, but I'm going to see if our audience can see it.
If not, we can just dive right in.
Okay. We'll give it a minute.
Okay. I tried sharing once more, but it's not going to happen. So let's dive right in with our lovely panelists. Over to you, Mo.
Thanks so much. So our webinar today is entitled Wellness and Care Practices Beyond 2024, how St. Clair College is setting a new standard for international student health in an evolving landscape. This webinar is a collaboration between St. Clair College, Student VIP, and the PI. So our goal today is to explore how international education institutions, particularly St. Clair College, is innovating in student wellness. We know that the international education landscape in Canada continues to evolve, especially of late. As new policies and growing student numbers, institutions must adapt by providing holistic, inclusive, and accessible care. In this session, we're going to showcase real-world examples from St. Clair College's partnership with Student VIP, providing attendees today practical insights that they can implement in their own institutions. I'm really excited about our conversation today, and I want to invite all of our attendees, wherever you are logging in from in the world, to participate in this conversation with us. So add your comments to the chat. Add your questions to the Q&A section that you'll see on the right-hand side of your screen. And be sure to log in to our polls that we have going. If you haven't already logged in, the first poll is, what would you say the biggest barrier for your international students accessing healthcare is today? So I'm going to ask you to all log in your votes on the poll. We will get to that shortly. But first, I'd love to have our expert panelists here on the call with us introduce themselves and tell us what your role is and what you bring to this conversation. So Sam, could I kick it over to you for the start off the intros?
Thank you so much, Maureen. It's such an honor to be here. My name is Samantha Morneau, and I am a partner and director of international at Student VIP. I've been fortunate to work in the international education sector for just over 14 years, and my role has evolved over those years from a student assistant to where I am today and everything in between. And so I bring expertise, insight, and I'm really big on data. And I can bring these things to this discussion here today because I work so closely with our partners like Nate at St. Clair College and Nicole, our partner over at Cleveland Clinic Canada, and Corinne, part of the nursing program at St. Clair. And we develop programs to meet the needs of international students, and we've delivered that through partners like St. Clair College. So we're able to talk about what this sector is doing today, what that looks like in the future, and using these examples of these programs and the data that we have to have a really great discussion here with everyone today. And so with that, I'd love to pass it over to Nate from the college.
Thanks, Sam. And as well, I'm very honored and pleased to be here with everyone this morning. My name is Nathaniel Velkamp. I'm the Director of International Education at St. Clair College, which is located in Windsor, Ontario, Canada. And I'm closing in on a decade here at St. Clair in the International Department. When I first joined the college, we had about 500 international students. And now we have over 8,000 international students. So been very part and probably for a lot of the guests listening in on this, you may be at institutions that have gone through that same growth. So we've had a lot of learning opportunities through those years. Just want to share a little bit of what some of the experiences and learning lessons that Sam and I've gone through with our community here in Windsor and Chatham-Kent, and on the campus community as it relates to the changing and evolving needs of international students that are studying in Canada in higher ed. And I'd like to turn it over now to my colleague Corinne, the chair of the nursing school at St. Clair. Corinne.
Thank you, Nate. And thank you so much for having me today. My name is Corinne Primo, and I'm the chair of the School of Nursing here at St. Clair College, which encompasses both the Windsor campus and the Chatham campus. So for myself, I've been at the college for a year now, so I'm bringing in a different lens of what's going on, as my background is an oncology nurse and manager, and I was 17 years in acute care. So really to be able to come into the college and take toll of opportunities is how I got involved with knocking on Nate's door and Sam's door to say, hey, we have a great population of students that are coming here from far, and here are some needs we have, so what do we do? And that's kind of how the tip-off happened, where we just said, look, let's get dirty, get creative, and think of ways that we can make it better for our students. So thank you for having me, and I'll tip off Nicole.
Thank you. Thanks for having me. My name is Nicole Niesner. I'm a nurse practitioner. I've been a nurse practitioner for 18 years and in healthcare for close to 25. I am the clinical lead of our virtual care platform for Cleveland Clinic Canada. We've had a relationship for the last several years with Student VIP. And really excited to showcase not only what we can do today and increase your level of excitement with our Tidal Care device, which we will introduce to you shortly, but really highlight how the platform, really comprehensively looks at student health, and really wanted to think out of the box in terms of what healthcare is important to students when they are studying here, and really diving into the breadth of not just acute and episodic care, but looking at chronic disease prevention, mental health, inclusivity for our BIPOC and LGBT two-spirited populations, and really going beyond a sore throat and a sore tummy, and really getting to the roots to manage all of their health comprehensively so they can be successful while they're studying here and beyond.
Great. And last but not least, Eileen.
Hi, I'm Aline Bordalo. I am a St. Clair College student, and the Cleveland app has been a true lifesaver for me. So that's why I'm here to share my testimony in using the app.
Thank you so much. And all of you on the call so far have mentioned the student journey. So it is completely fitting and appropriate and forward thinking to have a student be part of this conversation. So we're really thrilled that you're here with us today to participate in this discussion about the student journey, about student wellness, so we can hear from a student's point of view. So I've asked everybody to weigh in on the polls on the right-hand side about what the biggest barrier for their international students are in accessing healthcare. And overwhelmingly, the respondents have indicated that it's a lack of options. So we're going to hear about some of those options today and what they look like from this case study about what you're doing between this partnership between St. Clair and Student VIP. Now, I know that there is a lot happening in the Canadian international education space and student health. So Sam, can you talk to us a little bit about that, and where do we stand today?
Yeah, absolutely. I think a lot of us who are joining this call today are really familiar with the changes that are continuously coming down from IRCC. And I don't think we need to dive too deep into that. But thanks to our friends over at CBIE, we have some data on numbers. And what we do know is that last year, just over 1 million students came to Canada to study. And the majority of those students were located in Ontario. And after that, in the last year, caps were introduced to the international student sector, 10%. Now next year, we know there's an additional cap. It's now affecting postgraduate work permits, etc. And when we have these challenges introduced into the student sector, they're further creating mental health concerns. And even just in the last few weeks, having some discussions with some of our partners in the sector in the school world, they've come out and said, these students are already extremely under pressure. They're international students. We know all of that. But then now they're facing these concerns about housing, their financial stability. Are they going to be allowed to stay? Can they access healthcare when they need it? We have a height of maternity in our populations, right? And so now there's this new pressure that's been introduced. And we've started to already see a trend in international student healthcare where there's more complex and serious conditions being seen in a very young demographic. We're talking things with cardiology, neurology, even cancer, more in the last 2 years than we've seen traditionally in our student programs. And what we're trying to bring awareness to is that we need to adapt our policies, our health insurance programs, our services to meet these needs because they're now more complex than ever. We're so lucky to be able to have these students come to our campuses and enrich our communities. But ultimately, they're coming from countries where their socioeconomic status may be a little bit different from us. And if you're coming from areas where healthcare is not accessible and you don't have the same vaccine protocols that we have here in Canada when you go through school, that means that we have folks joining us that may have pre-existing health conditions or these complex healthcare needs, and we have to be able to respond because these students are coming and we want them here and we want them to be able to thrive. And so it's not a matter of not having students come and join us. It's a matter of letting them come and be able to be successful through these effective programs. And if we can get on top of these things and have this level of discussion and share these success stories, then we can do our part to help better this reputation that we have here and really truly show the international education sector that Canada does support students and we do care about their health and wellness, and there are options despite our country as a whole having significant barriers to access to care. If you have a family doctor, you're considered extremely lucky in our country now. And so it's really, really important that we focus on these things. And we're so lucky that AI and these innovative healthcare solutions from Cleveland are coming into play and enabling us to effectively offer solutions that are affordable and also effective. So yes, things are changing, but they're changing for the better.
Thank you so much for sharing that information and that data. And I posted links in the chat that speak to some of the stats that you've mentioned here this morning about the what some of those challenges are, what some of the barriers are, and how they are increasingly complex. So thank you so much for shining a light on that. Welcome to all of those who are I see some more folks have joined us since we've begun from Paris, from Alberta, from London, Ontario, and Edmonton, Treaty 6, Barrie represented in the house. So thank you so much for joining. And I invite you to also weigh in on our poll, add your questions to the question and answer section on the right-hand side of your screen. And please follow along with us and have this dialogue with us in the chat. And we'll be getting to as many questions and comments as we can during our discussion this morning. So you've really set the stage for us this morning, Samantha. And I want to talk about the partnership. What does it look like in action? So let's get into the case study and dig in a little bit to that if we can. I know that the partnership between St. Clair College and Student VIP has really set a benchmark for how institutions can provide comprehensive, inclusive, and accessible healthcare solution to their international students. So I'd love to talk about what some of those key pillars are for this partnership.
Yeah, absolutely. I think insurance is a great place to start. In Canada, institutions require students to have health insurance. And so everyone can relate to this aspect. And ultimately, when you come here, that's the piece you need. When you're sick or injured, when the rubber hits the road, the coverage is what you need to have in place and what needs to be effective. And so one of the things that I really like with Nate and St. Clair was that a few years ago, they really wanted to be proactive here. They wanted to take a look at their insurance program and find ways that they could make that coverage more comprehensive. And they have a really unique program in that it provides what's called medically necessary coverage versus emergency coverage. There's a difference between needing it to be life-threatening before your insurance kicks in, or you need medical care and a doctor or nurse has told you need medical care and it being covered. And extending beyond just the emergency piece, mental health should be an accessible benefit if you just need to talk to somebody. You need to be able to ensure that if you need to get home, whether that's because you're severely sick or you unfortunately have passed away, there needs to be coverage for that. Going to something as small as going to the dentist, it needs to be covered. And so, Nate, I'd like to really have you chime in here on when you wanted to overhaul your program and focus on creating this comprehensive insurance package. What was important to the college? What was maybe a non-negotiable for you?
Yeah, thanks, Sam. I think as I'm kind of listening in on this, I think for us at that time and still to this day, two important kind of words that drive our decision making is one, community, and two is family. We're a community college. In some sectors that could be kind of like oh, you're just a community college, but we really wear that badge with honor. We find ourselves, we're part of the fabric of the communities we're in. And so not only building community on our campus for our students, but supporting and being, an important part of our greater community. And we saw before we joined with Student VIP that we were more times than not more of a burden on the healthcare community that we were a part of. And so we really wanted to become a benefit to that local community. The second thing, the family. Those of us in international recruitment, we go around the world and we meet with these families, these moms and dads that are entrusting with us, their future, their children, and we really wanted to do honor by them by creating a family environment on campus so that when their students and their children joined us, they felt like they were part of an extended family at St. Clair College. And so by approaching our decision with the health insurance coverage and the extended coverage that Student VIP was able to bring forward for us, those two things were paramount. That we created a community, that we were a benefit to our community, but then that we looked after our students as if we were just a giant family. And when you look at it and you approach it that way, I think I think we've done well. We're not perfect by any means. There are still gaps and challenges that we face daily, but I think we're on the right path, and I think we're looking at it through the right lens when we're looking at it through family and community.
Yeah, absolutely. And, being able to have this type of program in place prior to a lot of these changes, where we know that schools are going to have to really up their game when it comes to international student supports. The information hasn't been super clear throughout on what that really means, but we know they've particularly talked about mental health being one. So how do you feel that doing this a few years ago has helped now with these changes, that being proactive part?
Well, yeah, it's approaching it from a community and a family perspective. Starting it as when you introduce something new, there's always some pushback, but I think St. Clair was a very welcoming college, whether it be the academics where Corinne's at or student services, even our student government. We really hit the ground running, and I think a lot of that is attributed to our partner at Student VIP. One of the first meetings I had with you, Sam, you'll recall, was we're a very decentralized international office, so a student is a student is a student, and I just encourage Sam and the Student VIP team to start to introduce themselves to other departments around the college. It doesn't have to be international led. Get involved from athletics to all these different departments, And student VIP did that. And so it was in a very organic growth quickly across the college community. And yeah, we've started to see those challenges with students with mental health and stuff. So that was really a key pillar in this new coverage for our international students and access. You know, we had a lot of students that were utilizing the emergency rooms for things that weren't necessarily, you know, an emergency, and just got in front of as many students as we could, leveraging social media and opportunities, and letting some of our stakeholders in the community know from different temples or places of worship, you know, employers in the community. We really just spread the news that the international student body now has this new coverage. There are a lot of key aspects in it that we were encouraging students to utilize. And I can see now year over year, the usage of the insurance is doubled or tripled in some cases. And so that's encouraging to us. Maybe not for our insurance provider, but as long as the college knows that students are making claims and are using and visiting doctors, whether virtually or in person, that's not a bad thing. That's a great thing. And that really is a testament to know that our students are comfortable with the provider. They're familiar with what's all covered, and staff are as well. You know, the director of student services will reach out to Sam if they've got a student in crisis, and you know, the I Am Well app that Student VIP is partnered with, you know, they reach out quickly. You know, unfortunately, we've had some cases where, you know, some additional counseling support need to be brought on campus through a traumatic situation, and you know, our partners there are there the next morning with counselors going into classrooms and making themselves available for students that just want to talk or you know, share with each other, you know, share with the counselor what they're feeling or what they're going through.
I like that you touched on using the plan, right? In the insurance world, that could be scary. And I like that when we have this conversation, the narrative isn't that, though. It's good. Students needed coverage for something, and there was coverage there when they needed it. And that's exactly what this is about. And I'd rather see that than not utilize it, no utilization, because there was an ineffective policy, right? And unfortunately, yeah, we do have students that have these critical healthcare concerns, and thank goodness there's insurance for that, right? And Corinne, you come from the oncology sector, you know what that's like from all perspectives, let alone if you didn't have proper insurance to pay for those treatments, right? You're already undergoing a lot. So that's so important. But it's also why partnering with Cleveland Clinic was such a no-brainer for us, because we want to be able to do a lot of things. One being create an access point to care that doesn't create claims against your plan, further inflating your program. So that's a great benefit of the virtual care program that we have with Cleveland. And the plan is that students can access it as much as they want, and a claim is never going to touch the plan. Awesome, a win-win. And the other part of that, though, is that in insurance, it's not uncommon for there to be a stability clause for a pre-existing condition. It's a way to make insurance remain affordable for students while still allowing access to care if your pre-existing condition is stable. In the situations where that's not, the coverage is not going to kick in. And what do we do at that point? This is a key component of that virtual healthcare service. Because we're not tying it to the insurance, there's no eligibility criteria there. So for those students who do have a pre-existing condition that may not be eligible for coverage through the plan, can still at least seek care through the virtual service. And that's been such a beautiful marriage. And we really need to talk about, though, the uniqueness of the virtual health clinic, because we're not talking regular telehealth. We're talking a really, really groundbreaking, revolutionary service, clinician pool, organization, not-for-profit healthcare institution, a leader in a lot of research, but it's the enhancement of being able to provide additional care. We're talking about delivery of remote diagnostics in an exam that you would normally need to get at a doctor's office. And so because I know folks usually go, what do you mean remote diagnostics? I'm going to pass it over to Nicole from Cleveland. And Nicole, I'd love for you to tell us a little bit about your role and what makes the virtual health clinic unique, and then a little bit about the TITO for those diagnostics.
Sure. Thanks, Sam. So for those that don't know, Cleveland Clinic was discovered in 1921 by a group of physicians that really focused on team-based care. And so it really speaks to our vision and our values in terms of the types of care that we provide, which is our vision is the best place to care for anywhere. And so anywhere can really mean in an office, in the patient's home, in a virtual clinic. And so we really stand by that. And as part of our values, inclusion and innovation is part of our 6 values. So standing behind that as well. So just to give you some context of how the students access us, our virtual health clinic is a nurse practitioner-led clinic. We service patients all over Canada. And the student can log on through an app on their phone, and then they will go directly to a nurse practitioner. So we don't have chat box, we don't have someone collecting your information. You will go directly to the nurse practitioner to describe what your concern is. Where the innovation comes is with our TITO Care access. So with TITO Care in our virtual care clinics, the student can have an entire examination with the TITO Care. The TITO is a device, it's about this big. And the device can look in the patient's ear, look down the patient's throat. The device can collect a full set of vitals. The device can auscultate or listen to the heart sounds as well as the lung sounds. If there's a skin issue, thank you, Sam. So Sam is demonstrating what our TITO device is right there. So you can see how compact and small it is. So this device, once inserted, for an example, into the patient's ear, is going to directly sync with my computer, in which I can see exactly what is inside the ear, as I said, listening to those heart and lung sounds. So this is a device that the student can have within their resident. This is a device that we can set up at a clinic that the student can go to and perform the physical assessment. And so what we're doing is we're bringing healthcare to the student. We're preventing the student to have to go to a hospital room, have to go to a walk-in clinic, because we're getting all of the objective evidence and advice that we need in order to make that diagnosis and continue with the plan of care or management. And so this really does speak to students that we're seeing with chronic diseases. So traditionally and prior to COVID, we really were seeing these types of patients in clinic, but now through innovation like the TITO Care, we can now conduct these physical assessments at home. It also speaks to the different types of trends that we're seeing. So when we look at prevention, specifically in the student population, we see mental health concerns, as Sam had mentioned. We also see a lot of women's health issues as well, and questions in regards to maternal care, prenatal care, contraception, sexual transmitted infections. So we do see these types of trends as well and questions. And so when we take our trends and we look at how else we can service our clinics and our students, we will soon be launching self-swabbing ability in the clinics as well, where the student can now have access to the swab, and through guidance with the nurse practitioner can now swab their throat, can complete an eye swab, skin swab, or a perineum swab as well. And then directly it would go to the lab, and then we can provide the diagnosis or results to the student as well. So this really does speak to, as I mentioned, keeping the student within their own space, but also keeping in mind that the average Canadian has a grade 4 health literacy. And so when we know that, and then we look at our international students that are coming over to a new country and are not familiar with their surroundings, there's a lot of case management that goes in case coordination to direct and help students to where they need to go. And so we've realized and have been appreciative with the Title Care that now we don't have to refer them as much to the emergency room or an external clinic because we can provide everything in-house. And so this really also does speak to prevention, because what I've noticed is when I find a student is unsure about something or not understanding something correctly, they're less likely to seek care for it. And so by doing this and being able to provide care as well in different languages that is more familiar to the students, I find we are seeing more issues and more conditions and more things are being caught before a more sinister side effect would happen to it, or it comes to the point where they do have to go to the emergency room. Now, I can't sit back and say we can treat everything virtually 100%. We know we can't do that. So for things as a trauma or an injury that they do need an in-person assessment, we really provide that hand-holding to the student, and we really want to ensure that they understand what is happening, where they need to go, how the insurance will cover it. And sometimes it's as easy as logging on, recognizing a provider that they've seen before and saying, do I need my white card? Do I need my blue card? Like, we take questions like this really for granted, because when we're dealing with an illness, we already have a certain amount of health anxiety going on because I'm not feeling well. I don't know what to do. I don't know where to go. Even just walking them through where the pharmacy is, what types of things happen at the pharmacy. So these are really basic questions that we can't take for granted, that we might know the answers to, but we really have to sit back and listen to the student and really help them and encourage them and be sure they understand what's happening. And so that takes a lot of patience, that takes a lot of counseling. And so that's what we're here for. And one of the pillars and one of the values we stand behind with Cleveland Clinic is students can log on and see us for as many concerns as they need to. And the time is not limited. So if we have a student that comes on with a mental health concern, we're able to sit and talk with them without having to limit any focus or any time for their condition. And so we're really grateful that we have the ability to do that. We have an excellent nurse practitioner team, and we're really excited to see where this relationship will come and go in the future. And again, if anybody has any questions about Tyto, happy to answer them.
Thank you so much, Nicole. You really did paint a clear picture about why the care model itself is so different and unique. It's comprehensive, it's culturally appropriate, it's inclusive, it's accessible. I had a recommendation from a student group to add that practitioners are trained and able to provide support to our 2S LGBTQ+ community, and that's been now listed on your provider profiles. So it's even that level of engagement too. And no better than, other than you as the expert with the clinic, than someone who's used the service. And Eileen, you've been so gracious to spend some time with us. And I know you're an international student and you're a parent as well. And so please tell us about your experience with the virtual health clinic and how that's helped you.
Hi. So first of all, I would like to say thank you. Because for me, when I find something that works for me and that is helpful for me, it's a pleasure to spread the word about it. Because if it's helpful for me, it will be for someone else. And I can say that the Cleveland app, it has been a true lifesaver for me and also for my family, because they are covered with the insurance too. So the first time that I used it, I was at home with my two kids. I have two boys. They are 5 and 7. And I was at home with them and I wasn't feeling well. So for me, it was impossible to go to a walk-in clinic because here I don't have grandma's house to drop them there, So I remembered about the Cleveland app, and I opened the app, and the app is very user-friendly. It's so simple to use. So I was directed to the virtual clinic, and I was able to choose a clinician from a list of providers. And in a few minutes, I was talking to a nurse practitioner. And she was really kind. She listened to all my concerns. She gave me a lot of medical advice. And I think that 10 minutes. I just got the medical advice that I needed, and I received the prescription. She sends the prescription to a pharmacy, and I just ordered a deliver, and I was good. So it was really helpful for me. And this was not the only time that I used it. There was a time that I used it for my son, my 5 years old son. And to be honest, in the beginning, I was a little bit worried about this interaction, like between a kid and someone in telemedicine, But I decided to give it a try. It was 7 p.m. My son wasn't feeling good. I was working in an assignment that I would have to deliver in the next day. So I decided to give it a try, and it was so good. I just met the same professionalism, the same kindness, and the way that the nurse practitioner engaged with my kid to let him share what he was feeling. For a mom, it was really good. And another fantastic feature that we have that is available at Jen's residence is the virtual online express care. So when we need like a more in-depth exam, we can go there, and there are some handheld device that we can use to check our lungs, our throats. So when we need something more in-depth, we can use this one. But for other things, the app that we have in our cell phones is useful. It's very useful too. So for me, as an international student, my life is really busy. We try to manage our agendas between work, assignments, internship, our families, and we don't have our parents here. We don't have our sisters here, my brothers here. So for me, it's a true lifesaver. I don't know what I will do if I didn't have this app in the palm of my hands. So I'm really grateful for having this.
Thank you so much for that really beautiful testimony and feedback. And it's so nice to hear from you directly. Again, you come from multiple different backgrounds of, again, being a parent, being a student yourself, and ultimately being busy and not necessarily having the time. And so you said something about the GEM residents, and before we touch on the way that the clinic has helped our nursing students, I think it's really awesome, Nate, if you speak to the GEM residents housing initiative that the college has, particularly when we talk about housing being a concern. Not only do you have this facility, you have a clinic right in the facility. So I would love to pass that over to you to hear a little bit about that.
Yeah, thanks, Sam, and thanks, Eileen, for your information and for sharing your experience with the Cleveland Clinic. St. Clair College is one of the first Canadian institutions that invested in on-campus accommodations for our international students. We have a 500-bed dormitory that is located at our main campus, and the ground floor of that is the Cleveland Clinic virtual clinic. So students there in the middle of the night, if they're staying in the dormitory, can go right downstairs, log in. It's a private room where they can go in, connect, use the device that Sam was so kind to show us how to use, and students can speak to a nurse practitioner in like less than 7 minutes. And again, when we meet with parents and students from around the world, and we can say, hey, listen, you can see a nurse practitioner in a few minutes. You don't have to leave the comforts of your dorm. That's great. And we're so excited that Student VIP has invested with us additional of these devices around our campus. So it's our goal to have these in every building location around the campus that are international students, and we've had some cases where domestic students have had to use it. And again, talking about barrier free, if a student is in need, a student can use it, or a staff member can use it if they need to. So we're very thankful for that. There'll be a location for that first one at the GEM residence and our main campus, and in our Chatham and our downtown campuses will be having these as well, just to again eliminate the barriers for our students to access this healthcare professionals.
Awesome. Thank you so much, Nate. And just being mindful of time and wanting to make sure we have the opportunity to hear from our audience too. And of course, Corinne, I'd like to transition to how the virtual health clinic has been supporting healthcare placement students. And we're talking about if you're in a nursing program, personal support worker program, or any other sort of program where there might be what's called a medical assessment that's needed to be done before you can enter clinical. So if you're a nursing student, you need to get so many tests done and vaccines before you can head off and be safely entered into the community. And that's tough. I didn't realize until I talked to nurses that who've gone through this, like Nicole and Corinne, that it's a lot to get done, whether you're a domestic student or an international student. There's a lot of steps. It's a little bit fragmented. And Cleveland Clinic Canada, yet again, rose to the challenge and was able to help streamline a little bit of that process. And before we dive in, Corinne, chair of the nursing program of the college, extensive experience in the oncology sector, just an absolute pillar in our healthcare system. Tell us a little bit about your role and what some of the challenges you saw in the healthcare placement programs that you knew we needed to find a solution for. Over to you.
Okay, so when I came in last year, it was August 28th, and students come in fast and furious. And in our healthcare programs here, we have a component of clinical. So it's not that the college needs people to have vaccines and all these tests done to be students here, but it's our clinical placements that require it so they can fit the bill for being safe and protected when they're out in our community placements. So the challenge is if a student comes in a week before school starts from a different country, we have a lot of work up to get done. So there's a lot of time crunch, pressure, and think about all the stress that puts on these students coming from afar, not knowing the area. How do we support them the best we can? And it was, we really realized that what was happening within the community, there's just not the resources to fit the bill for the flood of students we have at one particular time. So that was the challenge we were posed with. And how do you put extra stress on a student when they're just starting out their new program in a new country and trying to navigate their ways? As a college, community college, we know we can support them better. So it was just a matter of getting the team together and getting creative.
Awesome. Thank you. So Nicole, being a nurse practitioner yourself, a lot of time in the public sector and recently moving into the world with Cleveland Clinic, an expert as well. Having you and Corinne in a meeting together, it was phenomenal to hear you speak and talk about all these amazing things that can be done. And I'd really like to hear your take on the clinical side of things. So what did you and your team provide? Right down from getting the form circulated for staff so that everyone knew what would be required. I'd love for you to really take us through that journey and how it helped get these students at least started on their journey.
Thanks. So when we realized the students needed their online medical and vaccinations and teachers completed, we really were able to recognize the times that most students were connecting, which was in the evenings. So ensuring that we have less than a 5-minute wait time, we just ensured that we had enough staff on to service the students coming on, and knowing exactly just the blood work they needed for the placements. So when students coming on and saying, hi, I have a placement. Okay, we got you. I know what blood work you need. We have the forms provided. Blood work is going to be sent, but not only providing blood work for that visit, but taking the opportunity to say, hey, you're going to get poked. So if you are going to get poked, really assessing the students, say what else needs to happen. So doing a deep dive, for an example, into their dietary history. Oh, so you're a vegetarian? Okay, maybe we should check your B12 levels and make sure that you're not iron deficient. So really, again, going back to that comprehensive level of care, ensuring that the students are getting, quote unquote, the best bang for their buck if they are having to get their blood work drawn. And then setting up for something that we call My Chart. So then the patients, after receiving consent, we can then email all of their blood work results to them with the direction of once you have your blood work results, then the next steps are going to be an appointment with your health campus if you need a TB skin test, or providing a prescription for the vaccinations that they need, sending it to the pharmacy and having the pharmacist inject, opposed to then overburdening the health clinic if they need that injection. So just trying to work with the student, work with the clinics, being on top of what their wait lists are. So if we know we have a student that's starting a placement in 2 weeks and the campus can't see them for X amount of weeks, we know we kind of have to intervene and find another option for them. So it's just really like patient-centered care, and doing what's best for the student. And then, you know, for an example, as I had mentioned to Sam, like looking at other ways that our virtual NPs can support. So there is a blood test for TB skin testing opposed to a Mantoux skin test. So again, limiting that additional step where the student has to be seen in a physical environment and completing everything virtually. So there's always things that we're trying to think outside of the box that we can provide to the student. Again, not burdening the insurance plan or not having to bring in additional resources as well.
There you go. So the comprehensive care that Eileen talked about, taking the time to explain, providing that level of care and direction. Corinne, Nicole shared with me that they saw about 100 students. So we were successfully able to support international students getting started throughout their clinical placement checklist. On top of that, they didn't have to pay anything because they had access to the virtual health clinic service. It reduced up to 2 visits to a community health clinic that otherwise would be taken up by this type of assessment from an international student or a domestic student, but in this case, international student. So community was impacted positively, students were impacted positively, and you were impacted positively, I think, a little bit, Corinne, having some peace of mind with that. Tell us about that as an employee.
Absolutely, because we want the best for the students and we want them out to placement on time. The one thing I have to say, though, is I love our like dynamic team. So Nate, Sam, and I, at the beginning of August, we did a Teams call with a bunch of the international students before they came to get set up. And we were able to walk them through the process of how to log into Cleveland Clinic, what their insurance means to them. So we front loaded them a month in advance, where they actually had access to the Cleveland Clinic. Their insurance kicked in August 1st. So they were able to start the process before even arriving by calling into the Cleveland Clinic, having their first assessment, and getting their rec for their lab work. So they were ready to go to the lab upon landing in Canada, wherever it is they were landing before making their way to the campus. So really trying to be proactive with these students and also setting the stage for what the expectation of them is once they arrive, because we can't wait till you arrive on campus and then we say, oh, and by the way, we might have a month of health workup to do now. We want it front loaded so it's organized, concise. And I mean, we're still refining process, and that's going to happen. But I'm really proud of our team coming together and what we've nailed out in a year's time, per se. So it's been quite dynamic, and, you know, student feedback is very positive because they're getting excellent service, excellent care.
Thank you. The power of collaboration. We see it too often in the post-sec world, where a lot of silos, and sometimes things can take a while to happen. But when you have the right people finally coming together and having these types of discussions, bringing in partners like Cleveland to connect, and so you can speak medical to medical, it starts to break down those barriers. And then the effect is students have a better experience. And St. Clair College is a great community partner, being a facility that is training healthcare professionals to enter into our community where we desperately need it. And that's the power of international students, right? Joining these programs and helping to fill these gaps. We don't have the official word on what's happening in terms of, you know, where priority programs are going to be or anything like that. But Nate, knowing that healthcare is a significant program and that we're likely to see an increase in students joining these programs, how do you see this as being a piece of your protocols as a campus to make sure that you can keep up with that influx?
Yeah, it definitely, I think we're gonna, you know, again, looking into the tea leaves, I think healthcare occupations are going to be on that, you know, some of them should be on that list for eligibility for the postgraduate work permit. And so as a country, we need these graduates in going into the occupation of these skills gaps that we need in our communities. So I think just continuing what we're doing, refining some of the gaps that we identify as a team, but front loading it, getting to the student earlier. You know, I know that we've discussed, you know, identifying those students who have their study permit, you know, months before they move to Canada. You know, even working on some ways to maybe have them have their blood work or their vaccines with trusted professionals in their home countries can alleviate a lot of that burden. You know, and Corinne can talk to this, but you know, these are heavy programs, and so just, you know, as Corinne mentioned, setting the expectation, this is going to be a heavy program. You know, you already are drawn to these programs in nursing or other medical programming, and the last thing we want to do is with a heavy lift on the academic side is add to that burden on trying to navigate a very complex system like the Canadian medical system. So if we can alleviate a lot of that stress, I think what we're going to have is students who are happier and healthier in those classes, and hopefully the grades and the retention of those students in those programs will be a positive, and then we'll be graduating competent and successful students into our broader community in Canada.
I love that you painted that picture, that it's not just streamlining the experience of getting these vaccines. The impact is ultimately competent, healthy folks entering into our nursing and healthcare streams. So Maureen, Mo, you have been lovely. You and I talked before our presentation. You gladly gave me the mic. I wanted to just let everyone know that Maureen agreed to let me kind of take the reins here. And so I'd love to pass it back to you. I know we have a little bit of time for some questions. I can put my email in here for folks who do want to learn more. I know there was some questions in the box here, but Mo, please.
Thank you so much, and brilliant moderation. It's been such a joy to sit here and listen and watch you weave together these pieces of the conversation, and how all of these individual pieces really come together for a comprehensive program of supports. And something that stood out to me loudly and clearly throughout this discussion was options, and that really, I believe, addresses what our audience wanted to hear most about. So thank you each for sharing your individual perspectives, point of views, and sharing about the innovative initiatives that are happening. And our audience has some questions as well for you. So I want to, the show and tell bit. When you showed the device, I think that really spoke to a lot of us too, to say like, okay, what does it look like? And there are a lot of questions around that device. So I'm hoping that some of you on the call can speak to that. So how long after a consult does it typically take to get a device?
Sure. So that's actually a personal one, so which is great. If there's any folks who want one for themselves or their family members, they're actually available that way. The way they're set up with the school is they're in a different setup. They actually come with like an iPad and a nice stand. It has a drawer with attachments and such. So it's one system per campus or what have you. And so it stays right on site. So there's not one per student. And Nicole, I'd love for you to chat a little bit about, the safety of it. We do get a lot of those questions, and you have some great protocols around that.
Yeah, thank you. So the device is Health Canada approved. We do use it with all our patient population groups. So not just our international students as well. There has been studies for Tyto Care looking at the comparison of in-person exam versus the virtual images that we're getting from the device. They are comparable, if not better, and will show more objective findings. So for an example, when we're looking at a back of a throat and we're assessing for a sore throat or a strep infection, we would be able to see any incidental findings of, say, for an example, a precancerous lesion, a viral lesion, or a hand, foot, and mouth lesion. We would be able to see any abscesses that were formed as well, because the device has the capability to magnify areas 3 times fold, which is great. We can then take those pictures and put it into the patient's chart as well. So if we want to follow up with them in 48 hours, we now have something to compare it to as well. And similarly, if we wanted a second opinion and wanted to seek it from a specialist, we would be now able to take that picture and send it virtually to the specialist for a second opinion. So Tyto is great that way. Tyto also has a great AI capability. So for an example, in a patient with asthma, if I can auscultate or listen to a lung field and I don't detect a wheeze through my ear, Tyto will say, actually, there is a wheeze. It's just very mild, but it is present. So again, the AI capabilities and which are present now, we can weigh on, but also new AI capabilities for inner ears and heart sounds are now going to be coming out in 2025. So we're really excited to strengthen that relationship with Tyto and see what other use cases that we have options for.
Perfect. And I'll just answer one question about even cleaning it. So, there's signage, there's cleaning supplies that are provided, advising students, clean it before and after use. However, you can't use it without the clinician being connected with it. So a student would pick it up, be live told by the clinician, please wipe it down, while we trust that, and then at the end are said, please wipe it down again. So we're seeing live cleaning, sanitation of the device as students use it. And so to date, we haven't had them go missing. Thank goodness our students have been very responsible and respectful of the devices. Some campuses have them in rooms where they're open 24/7, like Nate and St. Clair. They really want to make this super accessible, so they do have that access. It's just in a residence where there is 24/7 moderation from a staff person, right? So love to share more details about the clinic, and my email's in the chat. And just to wrap up, because we did promise some takeaways here. And I think first and foremost, our institutions need to be assessing what their risk is as an institution when it comes to the health and wellness side of things. If students are going to go to other institutions because there's better healthcare access or better insurance, or their parents, and they know they're going to need to have quality care for their children, that's a risk. That's an enrollment risk, a retention risk, right? That's a risk to your institution if someone gets really sick and you don't have the proper things in place. So doing a quick risk audit, you can assess what you do have. Look at what the industry standard is. Get your coverage to that. What are the healthcare trends that we're seeing in our populations, and make sure your coverage aligns with those trends. A lot of information is available online. There's a lot of wonderful healthcare resources. And if you're lucky enough to have partners like Cleveland Clinic Canada, they always share data with us too on what's coming down the pipeline so that they're innovating. And that's my last point is, look at innovative solutions. The Cleveland Clinic service is really, truly a testament to the expansion of what's possible in healthcare and an affordable way to do that. Your student insurance packages should be student wellness packages. They have different healthcare needs than a domestic student. They do not have provincial supports to rely on like a domestic student, or things from mom and dad's plan. So it's okay if your student package becomes a wellness package, and it includes things like virtual care or legal and financial consultations like St. Clair has embedded in their program, and start to build that holistic program. So Mo, can we ask a quick question of the audience if anyone wants to chime in before we go?
Of course.
If anyone wants to share, is there one step that you think your institution will take in the next year to help better your international student wellness programming? Feel free to toss that in there if you want to add anything. And I'll toss it out to our other panelists too if you want to add any comments while we wrap up.
For me, I just want to thank everyone for having us. I think it's a great conversation to have, and we have to continue having it as things evolve. The climate of the international students coming here, we might see areas that are going to actually grow exponentially while others are not so lucky in that realm. But when I look at like our healthcare sectors, I think we're still going to see international student growth. So we need to be prepared to support them the best way possible. So thank you for this.
Thanks, Corinne. Nate, any final thoughts coming from the college?
No, we're just excited to have this be part of this conversation, and knowing some of the colleagues who are likely on the call. I know that we're an industry that's very progressively minded, and I know that just having conversations offline with colleagues at other colleges and universities in Canada, I know we're on the right path, and I'm excited for what the future has with these changes.
Awesome. Maureen, take us away.
Oh, well, thank you so much. I really enjoyed being part of this conversation, really listening to the experts on the call about this comprehensive system of care, about all of the options that you have available for students. Also, I appreciate the takeaway, these actionable takeaways. So important. And thank you for really highlighting that and bringing it all home for us, Samantha. 3 things that stood out to me, again, loudly and clearly as I was listening to you all speak, are the importance of honoring community, providing community benefits, and honoring family, being proactive and communicative, and the importance of offering culturally competent care. So thank you all so much for joining this morning. I hope you have a wonderful day or evening, depending on where you are tuning in the world. Thank you so much. And conversations to be continued. If you want to learn more, Samantha has added her email in the chat. Thank you all so much.
Thank you. Bye-bye.
Thank you.